Compact, flexible and comfortable for both you and your patients. With Carina, we offer an easy-to-use, non-invasive ventilator. Carina offers a wide range of advantages. Ease of use is one major benefit. We at Dräger are familiar with the special needs associated with the everyday hospital routine. By creating Carina, our aim was to develop a device which supports you instead of creating additional challenges. But why not see for yourself? This video will show you Carina's most important functionalities. You will see how to prepare and start up the device, how to operate, and as well how to clean and maintain it. In addition, we will present two real patient cases from the German hospitals in Lübeck and Hamburg showing Carina in action. You could of course view individual sections of this video. To experience furthermore the ease and efficiency of Carina, please have a look at the interactive Carina trainer. You will see Carina is a non-invasive ventilator which is easy and intuitive to operate. Please consider that this video doesn't substitute an in-service by your local Dräger representative. We furthermore recommend to thoroughly read the instruction for use.
In this chapter, you'll see Carina being prepared for connection to a patient. The Carina device must be cleaned according to your hospital's hygiene regulations and the instructions for use before connecting a patient. Now let's get Carina ready. Mounting Carina on the trolley and detaching it are very easy to do. The 4 pins secure Carina to the trolley. Simply push the red locking levers on the Carina to lock it into place. Now we'd like to introduce Carina a little further. The Carina has an integrated turbine, so an air supply is not needed. Additional oxygen can be added if required. There are various air inlets and outlets around the device which need to be kept clear of any obstructions. Ensure there is a space of at least 20 centimeters or 8 inches between the device and any other objects. The emergency air in and outlet and oxygen outflow are built into the upper and lower parts of the front and back panels. Do not cover these openings. The HEPA filter in the back of the device filters the incoming air. Always ensure that this filter is in place. Due to the integrated turbine and the possible oxygen supply, the Carina works very autonomously. The internal battery of Carina enables about 1 hour of operation. An optional external battery extends this time up to 9 hours. Carina needs to be plugged into the mains power for normal use and to charge the internal battery. Please insert the power cable into the device and secure it with the wire clip. The LED on the front panel will flash when the internal battery is charging. Different sources can be used to supply oxygen to the patient. The first is by using high-pressure oxygen via oxygen cylinders or a central gas supply. Please screw the oxygen compressed gas hose onto the high-pressure oxygen connector. Using a high-pressure oxygen source, you can set the FiO2 concentration directly on the device. Please remember that Carina regulates the delivered oxygen concentration. Because of this, we recommend using an external oxygen monitor. It's also possible to use a low-pressure oxygen source. Connect the oxygen supply line from the low-pressure source to the low-pressure inlet. The FiO2 concentration can't be set on the device when using the low-pressure oxygen source. The oxygen concentration needs to be set using the table in the operation chapter in the instructions for use. To achieve optimal performance with Carina, it's recommended to use only the accessories listed in the instructions for use or the separate accessory list. To avoid cross-contamination, an inspiratory bacterial filter such as the CareStar 30 should always be used. Carina can also be used with an HME. Please bear in mind that an extra filter, or the use of filters with high resistance, could lead to higher breathing resistances. Please change the HME and the bacteria filter according to your hospital hygiene guidelines. Carina has a convenient single hose circuit which is compact and enables easy exchange. Two different types of valves can be used according to the needs of your patient. The expiration valve is intended only for intubated patients and isn't suitable for non-invasive ventilation. The leak valve can be used for intubated and non-intubated patients. A selector switch located on the bottom of Carina needs to be adjusted according to the type of valve in use. Switching is fast, but ensure that a properly trained staff member chooses the correct setting. Using the leak valve circuit allows broader application for invasive and non-invasive ventilated patients. Now let's take a look at Carina's front panel. The high visibility TFT color screen displays value or curve information which can be easily customized to provide exactly the information you need. Several buttons and one rotary knob ensure intuitive operation. Pressing the Select Menu button lets you switch easily from one menu to the next. The Audio Paused button silences an active alarm. Silencing an active alarm will not prevent a new alarm from sounding. Use the 5 buttons below the display to choose the displayed setting options. A selected setting can then be adjusted by simply turning the rotary knob. Once you have chosen the setting, press the rotary knob to activate your selection. Ventilation can be started or stopped by pressing the Start Standby button. Let's take a look at Carina's screen. To suit your individual needs, you can choose between different views, pressure and flow curve, or a bar chart view with values. Both can be configured fast and easily. Press Select Menu, then Config, and select Screen Curves. The first view shows the pressure and the flow curve. You can configure 2 values, for example the breath frequency, F, and the tidal volume, VT. To select one of these, press the button below the value field. Then turn the rotary knob until the required value appears. Confirm the settings by pressing the rotary knob. If you prefer to view a bar chart and values, please select the second screen configuration by pressing the button below Screen Curves. Select the view Measure with the rotary knob. Press the rotary knob to set your selection. Setting values in the configuration screen opens a view which displays the pressure bar graph and all available values and settings. To provide the optimal support for your patients, Carina offers a comprehensive package of features and ventilation modes to meet your ventilation requirements best. Leak compensation and therefore synchronization is crucial for successful non-invasive ventilation. Carina's unique Sync Plus functionality with automatic leakage compensation is designed to improve your patient's comfort level during ventilation. This leakage compensation incorporates volume compensation to ensure the trigger sensitivity. Reduced auto-triggering will occur due to an integrated cycle learning technology and a multi-sense triggering detecting system. To make ventilation as comfortable as possible, the function Auto Ramp can simulate a natural breathing pattern. This helps optimize inflation flow delivery to your patient. The benefit of this function is that it eliminates the need to continuously adapt the ramp setting to the changes in the lung mechanics of the patient. Carina is a device with gentle spontaneous ventilation modes. Spontaneous CPAP or spontaneous pressure support is provided for patients who need CPAP but require no or minimal pressure support. Should your patient require mandatory ventilation, Carina provides mandatory ventilation modes such as pressure-controlled BiPAP, pressure-controlled assist control, and volume-controlled SIMV with autoflow. All these modes allow your patient the possibility to breathe spontaneously at any time. We call this room to breathe. For more detailed information, please refer to the instructions for use or the educational material on the Dräger homepage. To ensure a safe ventilation environment, Carina offers a sensitive audible and visible alarm system. A nurse call system can be connected via the nurse call plug. Before connecting the patient, we recommend performing a system check to ensure the device is fully functional. The checklist for the system check is contained in the Carina instructions for use. The system check is fast and easy to perform and takes as little as 5 minutes. The check includes the following steps. Make sure that all the necessary equipment is connected correctly, including the high-pressure oxygen hose, power cable, HEPA filter, bacterial filter. To switch Carina on, please push the power switch on the back of the device. When starting up, an alarm will sound briefly and the LEDs will light up. After Carina performs a short internal self-test, the device proceeds to standby mode. The screen provides certain information right away. Please check the status line to verify the correct valve type, leak or expiratory valve, is displayed. If not, change the valve or contact trained personnel to change the selection switch on the bottom of Carina. Please check the patient connection mode in the status line. It can be set to mask or tube. If it doesn't correspond to the used type, please make the necessary changes. Connect the test lung to the patient circuit. Now set the mode PC BiPAP. In the US, this mode is called PC SIMV. To do this, press the button below the set mode and turn the rotary knob until you see PC BiPAP. Then press the rotary knob to confirm your choice. All other changes can be quickly made by following the selection procedure. Press the button, turn the rotary knob, and confirm selection by pressing the rotary knob. For this mode, please select the following settings. Post-end expiratory pressure 5 millibars. Inspiratory pressure 15 millibars. FiO2 21%. Frequency 10 breaths per minute. I to E ratio 1 to 2. Ramp 0.2 seconds. To set the alarm limits, please press the button Select Menu, then press the button Alarms and set the alarm limits. Airway pressure high to 20 millibars. T disconnect 0 seconds. Please press the Start Standby button. Ventilation will now begin. Please compress the test lung. Each time it's compressed, expiration is possible. We call this free breathing. If the patient wishes to exhale, this is possible. This functionality is available for every mode of ventilation. Please compress the test lung several times during the upper pressure level. After a few seconds of compressions, you will hear an alarm signal and the message "Airway pressure high" will appear. Please confirm the alarm by using the rotary knob. Disconnect the test lung from the hose system. Immediately, an alarm tone will be activated and the alarm message "Airway pressure low" will appear. Please reconnect the test lung following the activation of the alarm. Please change ventilation settings to SPON CPAP. Settings apnea ventilation on. Alarm T apnea 5 seconds. The alarm T apnea allows the user to determine the apnea alarm time and the apnea ventilation start time. Now mimic a spontaneously breathing patient by pressing the test lung. When you stop spontaneous breathing, the alarm apnea ventilation will appear after 5 seconds and the apnea ventilation will begin. Now please disconnect carina from the external power supply. The alarm external power failure is activated. Next, switch carina to the standby mode. You have now successfully completed the carina system check. Carina is now ready to comfortably ventilate your patient. We would now like to show you how patients react to carina. We reenacted this clinical case which took place in the hospital Lübecker, which is part of the Mühlenkreis hospitals. The 450-bed hospital in Lübecker provides standard care and has 7 specialist departments. The ambulance brought a 96-year-old man into the hospital. On admission, he showed signs and symptoms of cardiac insufficiency and pneumonia, and it was suspected that a pulmonary edema had developed. Over the next 24 hours, the patient developed a non-productive cough, dyspnea, and was sweating profusely. Overall, his physical appearance was that of a much younger person, although the laboratory investigations showed, in accordance with his age, a leukocytosis, slight hyperkalemia, and hyponatremia. Blood gas analysis on admission showed a normal pH value and PaCO2, reduced PaO2, and an oxygen saturation of 90%. 4 liters per minute of oxygen was immediately applied via nasal prongs. Since there was no improvement in oxygenation, and due to the risks of invasive ventilation, it was decided to use mask non-invasive ventilation, or NIV. The patient was then transported to the ICU. Patient cooperation is an important element of NIV application, so it's always important to take the time to carefully explain procedures to the patient. It's also important to select a mask that provides the best fit to the patient's face, minimizing air leaks and improving patient comfort. Properly fitting masks also reduce the risk of problems associated with pressure from the outline of the mask. The nurse decided for this patient to use the Novastar mask from Dräger. The mask size should be chosen to ensure that the gel cushion is wider than the mouth. The mask should be long enough to sit firmly on the bridge of the nose while extending below the lower lip. With the help of the Novastar template, it's easy to establish the best size. The doctor in Lübeck decided to ventilate this patient with PC BiPAP. In this mandatory ventilation mode, the patient can inhale and exhale as he feels necessary. In addition, every mandatory breath is synchronized with the patient's breathing pattern. In order for the patient to become used to mechanical ventilation, the nurse holds the mask against the patient's face, at first quite loose, later with more pressure, until a seal is established against and around the patient's face. She continues this for 10 minutes and explains the ventilation process to calm the patient. When the patient feels comfortable, they begin securing the mask to the patient's face. To achieve this, the nurse gently pulls the harness over the patient's head. While the mask is being adjusted, the airway pressure low alarm may occur. This is due to high leakages caused by movement of the mask. Carina automatically resumes ventilation when breathing is recognized. They attach the two magnetic clips on both sides of the mask. Now they adjust the mask to the center of the face. Unlock the Velcro tabs and pull the strap to tighten it. As the mask will be worn for an extended period of time, they have to ensure that the straps are not too tight. The pliable ring embedded inside the soft, flexible mask allows it to adjust to the patient's face. The dual beam element in front of the nose can be adjusted with the thumb wheel. This enables the area around the nose bridge to be sealed without the need to pull the straps too tight. The mask fits comfortably and the ventilation settings are set according to the patient's situation. The patient can rest and relax and noise doesn't disturb him. Listen, can you hear the turbine? Carina's extremely quiet turbine supports a healing environment for your patient. The patient tries to speak to the nurse, the mask slips a little, and the leakage alarm occurs. The nurse silences the alarm and adjusts the mask to its former position and the alarm disappears. A safe and comfortable environment for both patient and caregiver is quickly restored. The patient responds very well to the ventilation therapy. After 3.5 hours, the patient felt comfortable and the blood gases are within normal ranges for the patient. At that time, non-invasive ventilation was discontinued. This patient case took place in Lübeck, Germany. Please follow your hospital's guidelines regarding how to treat your patients and how to proceed with ventilation. This patient case took place in the University Medical Center of Hamburg-Eppendorf in Germany. The University Medical Center Hamburg-Eppendorf is the largest among Hamburg's hospitals with approximately 1,400 hospital beds. The range of medical care extends from overall diagnostic service to highly specialized and complex treatments for uncommon diseases. An obese male with a history of heavy nicotine abuse was admitted to the hospital 4 days ago. Since then, he has been expectorating yellow mucus. Increasing dyspnea was evident. Physical examination revealed bilaterally reduced air entry and a prolonged expiratory time. After reviewing his lab analysis and X-ray of the thorax, which showed on the right lung basal infiltration, the diagnosis was hypoxic and pulmonary insufficiency due to an acute infective exacerbation of COPD. The patient is going to be taken to the ICU to be monitored and ventilated non-invasively with PC BiPAP. After the disposable Dräger Classic Star mask was adjusted to fit comfortably on the patient, PC BiPAP ventilation was started using an FiO2 of 50%. The inspiratory pressure was then slowly increased from 10 millibars until the necessary tidal volume was reached. The patient is now ready to be transported to the ICU. With Carina, you have the possibility to go on intra-hospital transport using the cylinder holders on the Carina. 2 oxygen cylinders can be easily transported with the patient, and the internal battery provides up to 1 hour of operation. The tidal volume fluctuates between 30 and 115 milliliters, which is much too low. The doctor suspects that due to the reduced consciousness, the upper airways are obstructed. She decides to ventilate this patient for a short period of time via a nasopharyngeal tube. After only a short period with the nasopharyngeal tube, the tidal volume increased to achieve a more consistent minute volume. The patient's blood gases improve, and as a result the FiO2 can be reduced to 30%. The patient is becoming more active, and the doctor decides to use the mode Spontaneous Pressure Support, or SPON-PS. This spontaneous breathing mode provides a pressure-supported flow-cycled breath when the patient triggers a breath. Due to the growing tachypnea of the patient, 5 milligrams of morphine is prescribed intravenously. After another 60 minutes, the patient's consciousness improves significantly. He is awake and calm. The ventilation therapy is continued via mask application. Over the next several hours, the patient is ventilated using a mixture of oxygen therapy and non-invasive therapy. In order to wean the patient, the breaks between the next NIV treatments are increased. The patient feels better and can now sit up in his bed. When he drinks, the nurse removes the mask and Carina automatically lowers the delivered flow. Additionally, for a set time T disconnect, no alarms will be audible. This feature increases the comfort of your staff and of the patient when the mask is being taken off. When the patient has finished drinking, he can put on his mask again. Carina automatically restarts ventilation with the former settings. His condition improved significantly, and after 30 hours, ventilation was discontinued. This patient case took place in Hamburg, Germany. Please be sure to follow your hospital's guidelines on how to treat your patients and how to proceed with ventilation. When performing maintenance operations, it's important to remember these important facts before starting the hygiene process. Comply with the hospital's hygiene regulations and follow the instructions given in the instructions for use. Clean and disinfect the unit. If there is a risk of infection, wear protective clothing, goggles and disposable gloves per your hospital's guidelines. Take precautions to avoid direct contact with chemical disinfectants. Make sure the area is well ventilated. Do not sterilize parts in ethylene oxide. This poses a serious health hazard. Do not spray the disinfectant directly onto the unit. Use a wipe for disinfection. Make sure that liquids do not penetrate the device. Please start by removing the mask, the leak valve circuit and the filter. The reusable NovaStar mask immediately goes into the hygiene procedure. The filter and the leak valve circuit are for single patient use only. Then begin the cleaning process. Remember the 3 steps of hygiene: cleaning the device, wipe disinfection, sterilization if necessary. Now wipe the surfaces with a clean, damp, lint-free cloth without using corrosive detergents. Wipe surfaces until they are free of all spots and dry them. Disinfectants based on these ingredients are suitable for carina, aldehydes, quaternary ammonium compounds. Please note that the concentration, temperature and exposure times are different with every different disinfectant. If there are questions, please consult the individual manufacturer's instructions for use. Only reusable ventilation hoses should be sterilized. Use detergent in the cleaning disinfection machine. 93 degrees Celsius or 200 degrees Fahrenheit, 10 minutes for damp heat disinfection. 134 degrees Celsius or 273 degrees Fahrenheit for autoclave sterilization. Please keep in mind the regular maintenance intervals. HEPA filter, replacement after 6 months. Device inspection, performed annually by trained technicians. Battery, to be replaced by technicians after 3 years. Make sure to check that the device is fully functional. This is very important. Any parts showing signs of wear, such as cracks, deformation, discoloration, peeling, etc., should be replaced. Once all maintenance steps have been completed, carina is ready for the next patient and can be assembled as described in the preparation chapter of the instructions for use.
I hope we've given you an interesting insight into the ingenious world of carina. You will find more information in our documentation and on our website, but why not contact us directly? You will see, it's worth it.